Tests, a pandemic, record-breaking homicides, suicides, and ODs on the rise. It is all taking a toll on Louisville's mental health.
WDRB's Katrina Nichols shares how groups are making sure people get the help they need.
After months, even years for some, of working and schooling from home and just the fear of the unknown,
Thinking about it as a trauma, which I think is fair to say,
the COVID-19 pandemic has had a negative impact on the mental health of people all over Kentucky. So 7 County Services is working to expand a program from just Bullitt County to 6 others with the help of a $2 million federal grant.
We know how to do the treatment. We've never had the right funding to do that treatment.
The grant will reimburse the group for providing things like transportation so people that want help can get it. It will also pay better wages to recruit experienced clinicians and collect data over a 2-year period to prove the impact of their services. 7 County Services says not only the pandemic has exacerbated the need for mental health services, but also the protests that took place in these streets in the summer of 2020.
We've had young people calling in on our crisis lines from the very beginning, all across our city and our region, with thoughts of suicide, thoughts of how are we going to grow up and be able to be good people in our community when we don't know this world's going to be here.
The conversation of mental health is something the city is tackling too.
trauma has a very powerful impact on how we think, how we feel, and how we interact with one another.
Which is why I was part of the mayor's weekly update this week, promoting getting help and simply just talking about it.
If people are able to talk about the trauma in their own way, at their own pace, in their own time, that the long-term prognosis is much better than if we're not talking about it at all.
Katrina Nichols, WDRB News.